We are an evolving species. We've mastered tools, conquered nature, leveraged the power of machines, and embraced technology in search of greater knowledge. Computers have empowered us further, and in the process, turn out enormous amounts of data. Today, we record and transfer more information in a year than mankind created over the past 5,000 years combined. Proof we are in the information age indeed.
Reading this morning that there's the healthcare reform has spent billions of dollars in incentive payments to physicians and other providers to increase the adoption of health records.
Mm-hmm. Do you think Canada's in a better position to adapt that sort of system, one that you think would be more effective?
In some cases, yes.
Mm-hmm.
I mean, I think that the fact that you've got a single payer, single provider service in Alberta, I don't know about
the rest of the country.
Yeah, the rest of the country, same. I think there's, with the right leadership. Mm-hmm. Speaking of election day, with the right leadership, you could see a leapfrog of what we've been able to do in the U.S.
One of the things you talked about is readmission, trying to prevent that. Tell us a little bit about your experience there, readmission to hospitals and how to prevent it.
Right. So it's a big problem in the U.S. and we think for Canada as well. 1 out of 5 people that gets admitted to a hospital is going to be readmitted to a hospital within 30 days. And that's a huge problem, very expensive, certainly impacts a patient's quality of life if they have to come back in an unplanned way for readmission. And there are lots of drivers for us to attack this problem. So what we've done is work off of insurance claims, because we don't have the electronic health records, off of insurance claims from inpatient records, outpatient records, and pharmacy records. Integrate that all and provide these dashboards that hospital administrators can look at to see overall trends that are influencing admission.
So sorry, when you say a dashboard, you're basically talking about a easily read graph, basically.
A collection of displays that allows you to take action pretty much immediately and monitor things that are impacting readmission. And then we give the physicians individual views as to which of their patients are at highest risk of readmission, so they can intervene and then maybe do some counseling, some post-discharge intervention like social work, outreach, that kind of thing, phone calls, when they think that a patient at high risk of readmission. So we developed a predictive model that actually looks at all that data I was just talking about and predicts what is the propensity for readmission and tells you why that patient was rated high for readmission. Our clients have been really happy with that.
So they would be able to then rank a patient as they come in according to their problems and the medication they may be on, and figure out whether or not they're going to end up being readmitted.
Right.
And why?
Right. And why?
Okay.
Yes, we can tell the factors why.
How? To me, that takes, I mean, you say the human equation is still important, but depending on who's running the operation, they may not look at the human equation at all. They may just look at it and go, these are the numbers that Deloitte gives me, this is what I believe in.
Yeah, well,
which could present problems in healthcare.
If you're a physician, you are not going to treat any black box as trustworthy. You are going to want to understand what you're given. So when we give that dashboard to a physician, we not only give the person, you know, this person is 83% likely to come back to the hospital. We tell them why, and we tell them which factors of that. This patient has a history of this particular diagnosis, these particular medications, and we've analyzed 250,000 patients, and these are the patterns. That we never would tell a doctor what to do. We just offer some insights based on similar patients that have been observed previously. It's sort of like having them read the literature, but except we deliver it just in time, rather than having them try to read it all in advance.
The value is not in the data itself. The value is in how we use the data, how the data analysis shapes our decisions, how it automates our machines, how it solves our problems, and how it changes our lives. The power of the data is set to be unleashed, and its impact will be felt everywhere. We are experiencing the dawn of a new age, the age of data analytics. Put bluntly, analytics is revolutionizing our health system. Analytics enhances environmental monitoring. Analytics empowers commerce. Analytics is a game changer for professional sport. Analytics redefines the very definition of community and Analytics will drive our future. How will analytics and big data shape Alberta, its economy, and its labor market? How will analytics and big data impact you, your business, and your life? Join global and local experts for 3 days of thought-provoking discussions, insight and foresight, and surprising discoveries. Analytics empowers better decisions. Register now for Canada's largest analytics conference.